Medicare for All is simpler, cheaper, more fair, and everyone is included. It's a fair deal for Americans. Medicare for All. In 1880, Otto von Bismarck required anyone residing in Germany to have health insurance. In 1912, Theodore Roosevelt called for a national health based on Germany's system. In World War II, civilian populations were targets, with many European countries suffering more civilian than military casualties. The medical systems were nationalized out of necessity to return soldiers to duty, workers to war factories, to protect against disease, and for morale. Medical care was nationalized, modernized, and made universal. With the arrival of peace in Europe, this trend continued and led to the crafting of national health plans. In America, there were virtually no civilian casualties. Socialized medicine under the Veterans Administration served the military only. Civilian health care, provided by for-profit insurers, remained a capitalist enterprise with good care available to the rich, with inefficiencies and exploitation for the poor, and potential financial ruin for the middle class. The profit motive, making money off bad medical outcomes by crafting for-profit plans with financially compromised politicians, remains to this day. But Americans believe healthcare is a right, not a privilege. Yet we now have the most expensive and least effective system of any modern industrial society. Under a universal single-payer healthcare system, the state pays for healthcare financed through taxes. The government assures the quality of care. It does not participate in care or collect data about individuals. Information remains confidential between patient and physician. It is cost-effective because it's simple. The doctor handles the claim. The patient is not involved in billing. Competitive practices like advertising are minimized. There are no deductibles. Copays are low or non-existent. A savings of 40% is possible with preventive health care, much less bureaucracy, and the elimination of insurance company overhead, hospital billing costs, underwriting, sales and marketing departments, and the huge profits and exorbitant executive pay. Single-payer systems do not devote large resources to screening out high-risk patients or charging them higher fees. A health card is issued. These can also be used for voter registration. There is no need for a variety of plans. Everyone receives the same level of care. All essential care is covered. Supplemental plans are available for cosmetic and elective surgeries. Coverage is not affected by loss or change of jobs. There are no lifetime limits or exclusions for pre-existing conditions. Physicians are chosen by patients. For a specialist, a referral is made. Inequities are reduced. Medications are covered for the elderly or indigent. Drug prices are negotiated by the government to control costs. Preventive care saves hundreds of billions of dollars. For example, cancer patients are diagnosed at stage 1 when treatment is outpatient, rather than when patients end up in the emergency room, require lengthy hospital stays, and face terminal outcomes. Physicians for National Health Program estimate the savings at $350 billion a year. The Commonwealth Fund believes the mortality rate would improve and the country would save $570 billion a year. Government already pays for most health care, 64% in 2013, but for a complex and fractious system. The Veterans Administration system is socialized medicine, owned, operated, and financed by the government. Medicare is a single-payer system for seniors, people with specific disabilities, or renal disease. U.S. administration costs are over 30%. An American pays over $1,000 a year just for administration. 25% of seniors declared bankruptcy over medical costs from 2002 to 2008, and 43% were forced to mortgage their homes. Single payer protects Americans from that financial insecurity and ruin. A $350 billion a year savings means $1,300 per person or $3,500 per household. Combining all American healthcare into a single, simpler system that includes all Americans just makes economic and operational sense. Since 1989, Representative John Conyers has introduced a single-payer government healthcare bill. Now, Bernie Sanders is introducing one. The net cost would be negative. The Congressional Budget Office and General Accounting Office report that savings would more than offset the expense of universal coverage. Medicare for All combines all current programs to provide free, necessary care, primary care and prevention, prescription drugs, emergency care, long-term care, mental health services, dental services, and vision care. Nonprofit health organizations can participate. For-profit insurance companies would be replaced. Medicare for All prohibits financial incentives based on utilization. Doctors are paid to keep people healthy, not sick. Medicare for All trains and pays physicians and healthcare workers to provide coverage to millions of formerly uninsured Americans, creating good jobs. It saves American lives and reduces pain, suffering, and financial insecurity. It keeps people well, not sick. A healthy and secure society is a more productive, aspirational, and a happier place. Medicare for All is simpler, cheaper, more fair, and everyone is included. It's a fair deal for Americans. Medicare for All.